Hey, it's Dr. Amanda with StraightSmile Solutions, StraightSmileSolutions.com, and today we're going to talk about lip bumpers. Lip bumpers. What I would use lip bumpers for, how I can use them in my practice, how you can use them with your patients. And for the most part, I use these on mixed dentition kids, interceptive from maybe 7, 8, 9, 10, 11. A lot of patients suck their lip as a habit, and it's a great way to eliminate that habit. There are ones that you can purchase that you have to pre-assemble with your own bands, and there's various sizes of, the wire and the plastic, whatever you want to call this thing, that fits into the bands, and then you're going to ligate it with either an elastomeric ligature or a steel tie. Those aren't my favorite because they're a pain and you have to measure them. Personally, I'm lazy with lab work, so I'm going to go ahead and take a scan or impression, send it off to the lab, and ask them to create a soldered pre-assembled one. Now, watch out, because some labs want you to assemble it yourself, so you need to make sure it's soldered and pre-assembled. I would double check before you order it like this. It's going to be made just about perfect. They can pick their acrylic, and it's already ready to go. Just drop some spacers in a few days before you deliver it, and you are good to go. Maybe stay in 4 to 6 months. Maybe on the top you might be doing some brackets as well. Maybe on the top you're doing an expander or something, but it's just a way to eliminate that habit. And often when you put brackets on a patient, they stop biting their lip anyway. So usually you don't, because it digs into your lip. So usually this is for more of a phase 1 where you aren't doing brackets, I would say. All right, thanks so much.